I grew up in Southwest Drive, which is a public housing project here in New Haven, or was anyway. It's now Monterey Place. In a community that saw as one of its primary responsibilities the care and nurturing of children. So it was a child-centered community. So what does that mean? That the adults in our small little neighborhood knew all the children, and we knew all the adults. There were clear community expectations for our behavior. There was an extraordinary amount of support for our growth and development, and a clear expectation that we were going to do well in life. So, you know, growing up in a housing project, we were not materially rich. I mean, we always had, our basic needs were met. But more importantly, we had a community, you know, families that understood what children needed, not from sort of the academic, more kind of clinical, developmental sense, just fundamental, you know, what it is that kids needed in order to thrive. So a healthy community is one where children are an end unto themselves. They are central to the community's reason for being. There is a moral fabric that informs the life of that community. There are high expectations for all of the community's members, not just children, but for adults as well. There is a sense of collective responsibility that we are all responsible to and for each other. As we moved forward, we moved away. We moved away from our, again, our collective sense of collective responsibility for each other. We've lost our bearings in terms of the function of family. Too many families became dependent upon public assistance as their economic viability. Our communities suffer when all of the social capital is not available to it. So, I mean, if you think about the numbers of African-American men, and now even growing numbers of African-American women who are incarcerated, each time we remove people from our neighborhood, we diminish its capacity to do what it needs to do. And that's attend to the needs of children. From my perspective, I think other people will have a different perspective. I worked in the private sector for about 10 years, came back in the public sector as a case manager. One of my first families was a young 14-year-old who had just given birth to, she was a 14-year-old mom. And so they were involved with the Department of Children and Families. I was their case manager, and I was doing all I thought that good case managers do. And on the periphery of, well, he really wasn't on the periphery. I think I marginalized him, quite frankly. Was this very young man, was the father of this little girl's child. And I ignored him. I literally, I mean, I acknowledged that he was kind of there. I mean, it's, you know, but I had no place in my thinking for him in the life of his child. And I was ashamed because I had bought the picture. The single female, African-American female heads of households, you know. See, one of the things that drives me in this work, there is no glory to be had in the public sector. There is nothing that the New Haven Family Alliance or any other agency that supports the well-being of people can do alone. what glory there is in the families that, because of our collective support, can improve their lives.